Hello, I am Dr. Satish Babu, Senior Consultant, ENT, Head and Neck Surgeon, working with the Apollo Hospitals, Bangalore. The trick in teaching a child with mild hearing loss is first to understand the disability. A mild hearing loss child is able to make out that there is some sound, something is being said, but the child is not able to grasp what is there. So if you look at the child's language development, it also will be similar. Whatever the baby is hearing, the baby is going to reproduce. So the first thing we have to do is, if you have recognized that there is a mild hearing loss documented, then make sure you are very slow in speaking first, very clear, and the words are coming out slowly and clearly, and if required maybe a little louder also, right? And if you keep the child in front of you, the visual clues like your lip movements, your posture, all these will give better input into the baby's mind, and the baby will be able to pick up the language better. Preferably the language that is spoken at home, the native language, is the first thing that we try to induce. So the child is more comfortable, the parent is more comfortable in teaching. And of course the other languages can slowly be introduced as one child gets more and more proficient in their native language, right? Main trick is to speak slowly, clearly, and more visibly. If required, a little louder, and that will take care of it. And asking the child to repeat whatever you've said before the child starts answering, if it is a question or acting the command, you ask the child to repeat it so that you can make out whether the child has really heard and understood the command or the question, right? So making the child repeat will also give you a clue as to how the language is developing. The baby is able to pronounce the words clearly, right? And the most important thing is that if you have documented that the child is having a hearing loss, please do not hesitate to give the baby some form of amplification like hearing aids. Then you are actually negating the disability and making the child listen properly. That will be the clincher if you have to teach a child a language or to speak.